Hi, everyone. Today we'll be talking about cyanide poisoning. I'm your presenter, Paris Burton. A look at cyanide. Cyanide poisoning is treated with specific antidotes and supportive medical care in a hospital setting or by trained emergency personnel. Antidotes for cyanide poisoning are most useful if given as soon as possible after exposure. The most important things for victims who have been exposed to cyanide is to seek medical treatment as soon as possible. What is cyanide? Cyanide is released from natural substances in some foods and in certain plants, including the pits and seeds of some common fruits. We'll get into a few of the foods later. In manufacturing, cyanide is used to make paper, textiles, and plastics. It's present in chemicals used to develop photographs, electroplating, metal cleaning, and removing gold from its ore. Cyanide gas is used to exterminate pests and vermin in ships and buildings. It's rapidly acting, potentially deadly chemical that interferes with the body's ability to use oxygen. Cyanide also is a colorless gas or liquid, such as hydrogen. It can also be a crystal, solid form, such as sodium cyanide or potassium cyanide. It's also known by military designations, uh, AC for hydrogen cyanide and CK. Uh, Cyanide is sometimes described as having a bitter almond smell, but does not always give off an odor, and not everyone can detect this odor. How people can be exposed to cyanide: skin contact, eye contact, or inhaling, breathing it in. Swallowing solid or liquid cyanide can be toxic. Following the release of cyanide into water, people can be exposed by touching or drinking water. Eating, drinking, or touching food or drinks contaminated with cyanide can expose people to cyanide. Who is at most risk for cyanide poisoning? Those that are most at risk they work in industries that use chemicals, and people who intentionally try to kill themselves, who take cyanide to kill themselves, to, by using cyanide pills or capsules. People may believe it is quick and painless death. However, cyanide burns the stomach and prevents the body from using oxygen, causing a painful death. What are the risk factors for the infectious agent? Um, how might you be exposed to it? By breathing, like I said, drinking the water, touching soil, or eating foods that contain cyanide. Smoking cigarettes, breathing air during fire is a major source of cyanide poisoning. Breathing air near a hazardous waste site for cyanide. Why is this infectious agent important to the clinical staff, the clinic staff, the patients, and the community? Because they need to know what protective gear to wear so they are not exposing themselves. And that gear includes gloves, um, uh, eyewear, glasses, protective apron, rubber gloves, that is, a face shield, using appropriate respiratory equipment for the concentration of cyanide, dust, or gas that may be in the air. How are the rooms sterilized or cleaned? You wear full PPE gear, bleach concentration, heavy duty gloves, place hazardous material in red container, not the garbage can, and a respirator. Thank you very much for listening to my presentation. I will now take any questions you have. Thank you.